It is 11:04, and once again, time for the PinPoint Health Show. PinPointHealth.ca or info@PinPointHealth.ca. Phone number, by the way, it's open. It's ready to roll. You got some issues you want to talk about. Be anonymous. That's fine. 416-870-6400.
Don't tell us anything. Don't say anything.
Yeah, everybody could be Jim for this morning. We don't care. My name is Jim. Okay,
when I was in school, we used to joke around, like as you're going through learning diagnosis and things like that. Students immediately think that like they'll hear two sentences, like two words from somebody, and that they know the diagnosis. And you know, now that I have experience and I do what I do, you realize how hard it is to come to a diagnosis. But the medical student syndrome is that you think you know right away type of thing, and so when I teach, I still teach the students. I always joke with them because when I hear them talk about this stuff, I'm like, you guys are at the point, like, all I have to tell you is my birthday and you could diagnose me, right? Like, oh, November 20th? Yeah, no, definitely disc herniation, yeah.
You know, it's funny.
Don't tell me anything except when you're born, and I should be able to figure it all out.
It's funny you mention that because you put up something on social this week about you. You went back and you were teaching at the college, and I saw you have a seminar there.
I teach. I actively teach. I'm there anywhere between maybe 1 or 2 days a week to some weeks as much as 3 or 4.
Have you found, in kind of the same way you just mentioned, have you found with the current batch of students, the new kids, for lack of a better term?
They are kids to me.
Yeah,
compared to me, they're
right?
kids.
Is there a Google influence? Oh, I read this or I've done that, as opposed to when you went to school, that wasn't as prevalent, right? And is it bad or good?
How old do you think I am?
Well, you're pretty old, but you know.
I graduated, June will be 8 years, so I mean, I don't think I'm that old yet. But is there a Google syndrome where students think they know everything? You know, in all honesty, and then maybe I'm going to say a bad thing here, I find like there's a lot of entitlement now more than anything. It's like, it's a different work ethic that I find with students. I even find that with new graduates. It's, you know, and again, I graduated 8 years ago, and me and my colleagues, I sort of know the way our mindset was. And then what I see now, it's like there's been a drastic change.
That's what I mean.
In that way. Well, the biggest thing is the entitlement factor, right? Like, you know, I remember graduating and I was working, it felt like 7 days a week. It was at least 6.5 days a week in terms of practice with patients, Sundays, like everything that you didn't want to work, I was doing it. But I did it because, you know, that's sort of the way you get started. You do the things you need to do. I've seen new graduates now that, you know, they'll call me and they're looking for a place somewhere, and it's like, yeah, I'm looking to work, 10 to 2 every single day and not Saturday and Sunday type of thing. And it's like,
settle down.
You know, you gotta like,
you want $100K too off the top?
Yeah, well, that's what I mean. And it's like there should be a high reward with very little work put in, and it's like that's not really the way it works in the real world. So I find that with teaching, you know, again, I remember being a student, and I think there's good progression, though, because I at some points I remember you almost couldn't even ask anything, or you couldn't challenge professors, where there's definitely more of that. But I do find that students, maybe because of how much more information is available, often can feel like they know more than the instructors. Never with me, but I've seen it with other instructors and lecturers and professors, and so I think that's interesting as well, because sometimes you got to be smart enough to know that you don't know everything.
Sure.
Right? So a little knowledge is a dangerous thing, right? So and these students, you're there for, you know, I teach first year, I teach second year, I teach third year students, and definitely in the first year, like, you're dealing with people who have been exposed to this they have undergrad degrees, everyone has an undergrad degree, but they're exposed to the relevant material that they're going to be practicing, you know, for 3 months or something, and they already think they're experts. So
let me bounce over the other way, which could be more of a, I guess, pain in the butt for you as a practitioner. You get the patient syndrome doing the same thing, because, you know, Google Med School is huge, and that's such a hill. The
Google aspect for patients is huge, right? Like, everybody comes in now, and it's funny, so many people will come in and they know their diagnosis, they know their prognosis, and they know their treatment, right? Like, they've figured it all out, and then they don't want to do it either, right? Like, it's like, I know I have to do all this, but I actually don't want to do it, so what's the easiest option? And it's like, you know, and the one good thing that I will say, I shouldn't say the one good thing, but I think what's important here is obviously the vast majority of new patients that I see is through this radio show.
Yep.
And I think people have heard me, so they know sort of my stance on this, and that I'm no nonsense type of person. I give it to people pretty much the way it needs to be given,
Good.
very politely, like the same way I do on the radio. But I tell people what I believe the truth to be, and I don't really try to sugarcoat it. I do a very good job of explaining it, and I think people know my opinion on self-diagnosis, self-treatment. It's not the right thing to do.
Sure.
You should be looking for professionals to do this stuff for you, because that's why they exist. And if you do it yourself and you think you know everything, that's where, unfortunately, bad things can happen. And so, yeah, I definitely think that it's a problem with patients that they come in and they know everything. They know they've come in. It's like, yep. It's not the vast majority either, though. I think a lot of people that come see me are actually very receptive and are interested in what my particular thoughts on the subject are.
We'll get to more of what happened with your week, and for you as well. If you have issues, something you just want to ask about your health, bring it on. That's why Dr. Lou is here. 416-870-6400 *640 on your cell. Pinpoint Health Show continues. This is Global News Radio. Pinpoint Health Show, indeed. You want to reach out to Dr. Lou when the show is not on. 1-855-55-DRLOU. Dr. Lou and Pinpoint Health on social. There's always amazing stuff up on Facebook and Instagram, videos and how-tos. And I look for it daily, man. The stuff you put up there, it's great.
Thank you.
Dr. Wilder doing great stuff, and
Adam Wade,
sorry,
up in Newmarket has produced a lot of videos for us on different exercises and tips. So worthwhile for anybody listening. Please, join in. Another thing that actually I wanted to talk about is Google reviews. Okay. So if you've seen me, and because again, I'm open to the constructive criticism, and I think it's a good way for people to know if you've seen me and you enjoyed your experience or you didn't enjoy your experience, you can leave. If you just type in Dr. Lou on Google, you'll find my sub Google page or whatever it is, and leave me a review. I'm happy to hear what people think. I know that a few people have added me to Rate MDs, and it's been very good reviews, which is nice. So, but I think Google reviews are like the big thing right now. So, So feel free to leave me a review.
416-870-6400 *640 on cell. Bring them on. Hey, Sam, how are you?
Good. How you doing?
Good, pal. What's going on with you?
I'm having some issues. I have, diagnosed as tennis elbow. I was put on Vimovo, and just wanted to know what else I can do to kind of remedy it. Just kind of repetitive movements at work. So just thought I'd chime in and see what you guys have to say.
Mm-hmm. Yeah. So, I mean, medication is not the right first line of defense for that. It's a physical problem, and physical problems always need physical interventions. The good thing is it's on the low, like the very simple spectrum of mechanical problems. So you're dealing with something that's a repetitive strain, sprain in the muscle and in the tendon. Often some good manual therapy, exercises, maybe some bracing are the best options. The anti-inflammatories, it's not really doing anything. It's not an inflammatory process. So it baffles me why this stuff still gets prescribed for these types of things. So I would think that you need to focus more on those types of interventions versus the medication.
So I do have a brace. I ice periodically. So when you say exercising, what type of exercise?
So the best thing would be, my first encouragement would be therapy. For that, because you have to get in there, break down some scar tissue, potentially do things like all that stuff is just way too passive in nature. Then the other thing that exists is if it's a result of the things that you're doing, then maybe modification of those things is also important, because I mean, you can get the best therapy in the world, but if you go back and you do the repetitive sprain that you're doing, then you can't be surprised that it'll continue to hurt you. So sometimes, and I'm not saying don't do what you have to do, but there are ways to modify it.
How do you think it came about, Sam?
I guess just being, I'm doing manufacturing, and it's just the same repetitive movements for the last 20 years.
There you go.
Yeah.
Right?
Yeah.
And I think I can't, alleviate the job aspect. But when you say modification, I guess I'd have to look at different ideas as to how to not.
Yeah, and that's what we help with a lot of, right, is we try to understand the physical demands of your job and give you the the ways that you can modify that through like an occupational medicine type of approach. So there are ways, but I do think you need someone actually working on that elbow with manual therapy for it to probably get better.
Okay, perfect.
Okay, give us a call.
Thanks, Sam. Appreciate it. Again, 1-855-55 Dr. Lou, DRLOU, to reach out, or info at pinpointhealth.ca. Oh, tennis elbow, man. I thought that was bad till like a golfer's elbow.
Same thing. It's the same.
Nasty.
Yeah, it's the same pathophysiology.
Yep.
It's just one is on the outside and one is on the inside. It's just repetitive strain sprain of either, with one it's on the lateral aspect, which means the outside. The other one is on the inner aspect or the medial side. And it's the exact same process. It's just a different name because, a backhand in tennis is more common, so you're using more of the extensors. And in golfing, there's no backhand component,
right.
So you're often dealing with the golfer's elbow. But it's the exact same pathophysiology. The recommendation on that is deal with it the right way early, because if it does go on a long time, it can get to the point where it starts to create like what's called an enthesopathy, which is where the tendon actually starts to have micro tearing off the bone. And when it happens there, that's much harder to treat. It's always easier to treat when it's in the muscle belly, because muscles,
regenerates, grows.
Yeah, and when you look at a diagram of the human body and muscles are red and tendons and ligaments look white, there's a reason. That's purposeful. It's because they don't have blood supply, and that's what helps in the healing process. So muscles heal much better, and it's better to deal with it when it's in that aspect, and then and don't let it get its way to the tendon.
See how nicely that works? Get some answers. 416-870-6400 star 640 on cell call. We got lines open, ready to talk to you as well at 11:20 Pinpoint Health Show, Global News Radio. It is 11:23 Pinpoint Health Show. You want to make a phone call, get some answers. 416-870-6400 star 640 on cell. Be a good place to start. Fred, thanks for hanging on. How are you?
Okay, good morning. Good, thank you. How are you?
Good. What's your concern?
So I have a knee injury back from 2014. I went back and forth with my family doctor a few times that it wasn't a big deal. I just needed a brace and it would heal. Eventually last year I got an MRI done, and I have a tear in my meniscus and my ACL. So I got two opinions from specialists. One guy said that he could do the surgery, it would be a year recovery, and I'd wear a brace and it would be okay. And the other guy said, that it wouldn't be worth it just to get a proper brace and try to live life like that, because eventually I'm going to end up with arthritis because I waited so long. So,
yeah, this inherently is the reason why we have the knee clinic here. So before I answer your specific question, Fred, I just want to take a minute to highlight something. So, this is the exact example. You see your family doctor, it's delayed, you don't, just do this, it should heal on its own. And then, a lot of time goes by, and then finally you figure out that there's something that would have likely been, number one, treated better. Again, it's a physical problem, likely needs therapy, and not just immobilization or whatever. Couple things going on so how old are you?
I'm 25.
25, and it's a meniscal tear. Do you know what type and where, or you're not sure?
I'm not sure. I just know that I have both the ACL and the meniscus torn.
Okay, and symptomatically, what is it that you feel? Is it constant pain all the time? Is it very sharp pain at certain times? Is there's locking, there's clicking?
It's really only when I aggravate it. Most of the time I can walk and function fine, but maybe if I turn or twist the wrong way, it would be in pain for a couple days, and then it would be back to normal. So,
okay, fine. What are the things that aggravate it then?
Just turning the wrong way, maybe putting too much pressure on it, maybe walking too much one day, stuff like that.
Okay, and what about, are you active? Do you run, anything like that, or no?
I don't run anymore, no.
Okay. If you did run, do you think it would bother you?
Maybe not the first time, but I think repetitively, probably yes.
Okay. Yeah, so there's a couple things. The year recovery for a meniscus repair seems very long to me, so I'm not really sure why that was told. At 20, you said 25, right?
Yes.
And you're healthy otherwise?
Yes.
Yeah, so, I think I'm not telling you whether you should or you should not have surgery. I can tell you that if you come see me and I assess you and do my due diligence, I'm happy to tell you that. Just in general, though, if it's something that's surgical and it's still bothering you, it may be a worthwhile option to consider. Another thing that I will talk about with the custom knee bracing for these types of things and why a lot of surgeons recommend it is because a lot of surgeons actually get a big financial incentive to refer for those braces. So I think, you should always ask your surgeon if there's a financial incentive for that brace, because you would then know what the reason for that referral is, because again, they're pretty big money in terms of those things. That doesn't mean that they don't have a place. So I'm not trying to suggest that they don't. They are often very important. But I again, when you hear such stark differences in recommendations, you start to consider, well, what could potentially be the reason? So that's just me thinking out loud, talking to you. In terms of a second opinion on whether you should consider surgery or not, I think you should come see me. We can also get you to see one of the surgeons that works with me, and then they can assess you as well and sort of come to a game plan on what might be the best approach. But there's definitely something that can be done. It's a matter of trying to figure out what it is that can be done and whether or not you are willing to do those things. Okay? Give us a call, 1-855-55-DR-LOU, DRLOU.
Thanks, pal. Appreciate that. Talk about, because we haven't really brought it up for any great length of time in a while, the knee clinic. Give me some more details on it.
Yeah, I mean, I guess it's been a while since we've spoken about it. Yeah, you're right. So it's particularly designed to identify those problems. Mm-hmm. And in fact, we're working on something to do the same thing with shoulders. Excellent. So
another wacky joint.
Yeah, so the big thing with knees and shoulders, and you know what? Actually, I think from now on, I'm just going to call it the knee and shoulder initiative, because we could do it for both. If you have a problem in those things, specifically in the acute scenario, because this is where surgery might likely be necessary so the example, let's use the knee. If you've had knee pain for the last 10 years and it's a result of osteoarthritis, still give me a call. But in terms of getting surgery, that's not the surgery we're expediting. The surgery we are expediting is this type of scenario where, you're everything is fine. You're playing basketball, you go up for a layup, you come down, you feel something really bad happen in your knee, and all of a sudden it's like, oh my God, what happened?
Right.
Give me a call. We will get you in. If it's something that is surgical, we will get you to have that surgery much sooner than if you take the traditional approach of which you just heard. You go to your family doctor. Family doctor says, you probably sprained it. Take a couple weeks off and we'll send you for an x-ray and just make sure nothing's broken. Provides no real information. Nothing gets better for a few weeks. You go back and it's like, okay, well then, maybe we'll try this. Go get an ultrasound. Ultrasound's not overly conclusive. By that point, you're already 6 weeks in, maybe 8 weeks. And then you go back again, and finally they say, okay, let's refer you. You go through the regular channels of being referred. Maybe that's another 2 months. You finally see the surgeon who says, I think you need to have surgery, and you're having surgery 6 months later.
By the time you're retired. Right.
6 months later. So from the date of the injury. Versus if you call Dr. Lou, you have the injury, you give me a call. If it is something that needs surgery, I don't want to use the word guarantee because then people will hold me to it. But I promise you that I will do my best that you'd be getting surgery within a few weeks.
Expedited manner.
It's pretty good, I'd say.
1-855-55-Dr. Lou, by the way, is that number. But for the remainder of the show, the next half hour, you have questions about your health as well. Would love to talk to you. 416-870-6400, star 640 on cell, PinPoint Health Show. Global News Radio. It is a beautiful Sunday morning, not afternoon yet. Saturday, pardon me.
Come on.
I know.
Jody,
dude, I get this.
Jody, do you believe this guy?
I can't.
My God.
Oh, shut up. I've known you for like 25 years.
Oh, my God.
I can't. Should be a soap opera. Unbelievable.
What you can't see is I can always see Jody nodding when you do something. It's like he's always so disappointed.
Guys hate me. Hi, Danny. Save me. What's up, pal?
Hey, how are you?
Good, man. What's up? What's going on with you?
First-time listener. I was just thinking about what you were saying. You talk about back pain?
Mm-hmm.
Yep.
Okay, so I'm 24 years old. I hurt my back 2 years ago at a grocery store. I lifted a box. I guess I twisted the wrong way.
Yep.
And I went to the doctors right after that because I was pretty much like in pain for like a couple days.
Right.
And he looked at my back, did x-rays and everything. He said nothing was wrong with it. He said it's fine. but ever since that day, I've never been the same. I get constant back pain every day, and I'll randomly get a sharp pain in my tailbone.
Very, very common story. So obviously something is wrong. You know, it's always funny when you hear that nothing's wrong. It's like, well, something must be wrong. The question becomes, how bad is that wrong? Is it something that's horrible, or is it something that's manageable? Like, you know, so definitely something is wrong, because this is very common. You had an acute injury. That acute injury has now led to a chronic issue. That chronic issue has to be dealt with. Mm-hmm. It's not, I'm going to be honest with you, and if you said you're a first-time listener, and people who listen to the show every week know the way I am about this, new problems are much easier to treat than old problems, because they're old and they have a lot more complicated things that happen, and scar tissue and the neuropathic pain, which is an amplification of the nervous system. And so there's a lot of things that are intertwined in that. But that doesn't mean you can't do anything about it right now. And the fact that you're still young is a good prognostic factor for you to do the right things. But yeah, it's not an uncommon story to hear that someone has an acute injury, doesn't really do the right things for it, not by your own fault, and then develops chronic issues and is never quite the same. So, you know, same thing. I see you're calling from Brampton. We actually have a clinic in Brampton as well. So it would be good for you to come see me first, and then we can make the appropriate referral for treatment to help get you better.
All right, perfect.
Okay.
Where do I go to find?
Yeah, so you can send me an email at info@pinpointhealth.ca, or just visit pinpointhealth.ca, or call 1-855-55-Dr. Lou, DRLOU.
All right, perfect. Thank you so much.
No problem. Take care.
Thanks, man. And just as an aside, get on it and don't wait, because he is me, exactly half his age. I was 22, 24 when I hurt my back, and man,
it's incredible how many people like that listen. And again, by no fault of his own, right? Mm-hmm. So this is a person who said, okay, I'm not a professional in this. I'm going to go see a healthcare professional and get the recommendations that I need, right? No different than what we heard before with the knee issue. There's also professionals that make the wrong recommendations, is the unfortunate reality of all this. So, I mean, that's also part of why I do what I do here. So if you, your loved ones, anyone that you know, you're suffering from a mechanical issue, a pain issue, an injury issue, you should be giving me a call. Doesn't cost you anything to call me. There's no fee. There's nothing. But you should find out what your options are. Yeah. And often dealing with it the right way is the way you get better.
And there's usually never a downside to getting on something early rather than later. Just I mean, if you're listening and you have an acute injury and you're not calling right now, man, you're making a mistake. 416-870-6400 star 640 on cell. Julie, thank you for hanging on. Good morning.
Good morning. I was calling about I have two hernias. Okay. And I just wondered about this mesh. When they repair with the mesh, what you kind of know about it, and also what kind of exercising can you be doing now that I have these hernias?
Yeah, so I'm not an expert in this. This is a very specific type of person and doctor that deals with this. I don't deal with this, and nobody at my clinic. We often see hernias because they can present as mechanical pain where someone feels it and is wondering, is it a muscle? And so it's often a differential of ours where we consider, could this be a hernia? So we do see a lot from the diagnostic perspective, but then we refer them out for repair. So I know of the procedure that you're talking about. In terms of its efficacy from a scientific perspective, I don't know the answer to that. I would encourage you to speak to whoever is recommending that. That would be the best person to give you those answers. In terms of hernias, you know, if you get them repaired, you can typically do whatever it is you need to do. Usually with hernias, it's kind of opposite to what people think. It's the amount of strangulation. So typically smaller hernias are more likely to strangulate just because of the very nature that they're small. Those can potentially be dangerous, whereas when they're bigger, there's a lot more room. But obviously it's a scarier thing because it's bigger. So, I mean, you know, again, I'm not an expert in this field. We identify them, then we refer them out for repair. So I think all the questions you have are very good questions. I would just direct them to the appropriate professional. Okay. Good luck.
Yeah.
Thanks, Julie. Appreciate the call. Nicely done. We'll squeeze Mark in here before we take a quick break. Hey, Mark. Good morning.
Good morning. How are you?
Good, pal. What's your concern?
About a couple months ago, maybe 3 months ago, I switched to. I play a lot of soccer, right?
Yep.
I'm 47 years old, and I play a lot of soccer, but usually about 3 to 4 times a week.
Good.
And basically, I switched cleats to a new outdoor cleat, and they were a bit pressuring in the back of my right heel, right? And the next day, I started getting a lot of pain in my Achilles, and I went to the walking clinic, and they said I had Achilles tendonitis.
Okay.
So I should, strengthen the calf muscles, et cetera, lay off soccer. Anyway, I went to my physiotherapist, and she says I don't have Achilles tendonitis based on the strength of my calf, and et cetera, et cetera. She suggested some stretching. So
Okay.
I've been doing the stretching, and it seems to help. And the only thing that, when I start playing, it hurts a lot. But once I warm up, it's great. I have no pain whatsoever. It's the next day. I'm feeling a lot of pain. I can't even walk down the stairs.
Mm-hmm.
And with throughout the day.
And the pain is in the Achilles?
Yes, the pain is in the Achilles itself.
Yeah.
Correct. Back of the heel.
Yeah.
So it's going down towards the heel. It's just not on the bottom of the heel, just towards the heel.
So, yeah, okay. So, I mean, assuming, again, I can't diagnose you because we're over the radio, but assuming that the diagnosis is an Achilles, it's not really a tendonitis, it's a tendinopathy or a tendinalgia because there's no real true inflammatory process. But assuming that that's right, stretching is not the right thing. I actually agree with the walk-in doctor, which is eccentric loading. So you need to be strengthening the actual tendon, not so much the calf. They're connected, so inherently both are going to be strengthened, but you do it in a very specific way, which is called eccentric loading of that tendon. So it's not your typical, calf presses or whatever like that. There's specific things that need to be done. That's assuming it is a tendinopathy. I don't know. That's the part that I would need to do. The other thing is, if it is a tendinopathy, often what can help is putting in a very simple heel lift into the shoe, which just takes a little bit of pressure off because you're in a slight plantar flexion, which is, imagine your foot just pointing down a little more. And so you're just relieving some of that pressure on that. But again, the problem sounds like you probably just don't have the right diagnosis from either party, and so I think it might be worthwhile for you to give me a call and we take a look at that, and then we'll make the right recommendation.
Yeah, because I actually tried that the heel lift. I have a little insert in my cleat.
Okay.
Didn't really do anything.
Okay,
right?
well, give me a call and let's take a look at it.
Mark, appreciate the call and do so. 1-855-55 Dr. Lou, DRLU. Give Dr. Lou a call or pinpointhealth.ca for more information. We'll take a short break. Get back to your calls. 416-870-6400 star 640 on cell. Pinpoint Health Show, Global News Radio. 11:45, and it is Saturday morning here. A beauty out there. And your phone calls for the remainder of the show. Bring them on. You got 15 minutes, give or take. 416-870-6400 star 640 on cell. You want to reach out afterwards to Dr. Lou. That is simple. 1-855-55 Dr. Lou, DRLOU.
So let's talk about, in particular, 3 specific clinics, just so people are aware. So I think it's important that everyone knows. So if you're in the Newmarket area, the Richmond Hill area, or the Brampton area, and I'll be a little more specific. So downtown in Newmarket, Main and Water, we have a clinic there, great reputable clinic that's been there for a long time. We took it over not too long ago. Great staff there. If you're in that area, I really encourage you. Any pain, injuries, give them a call. You can find all this information on pinpointhealth.ca. Richmond Hill, Major Mac and Young. I mean, you can't get more central than that. It's its own standalone building, so plenty of parking. Even in Newmarket in the downtown core, it's a corner building. There's parking at the back, so no fee for parking, nothing like that. Just it's great. And the Major Mac and Young location is just an incredibly convenient location for so many people. And then if we move all the way over to the other side, the west end, Brampton, Mississauga Road and Steeles area, just north of Steeles, closer to Financial Drive, where Lionhead, the golf course, is across the street. A lot of new development, but that's pretty convenient for anybody in that Brampton area, Caledon, the east end of Caledon, the west end of Caledon, or Georgetown, which we get a lot of people from there. So, I just want to bring that to everybody's attention. If you're in those areas, specifically give PinPoint Health a chance to be part of your healthcare team. I think if we're given that chance and my team is given that chance, you'll be very happy, and you will not have made a mistake, which is a good thing.
Right by Lionhead, good. You get all the boys coming over the backs and the elbows pretty soon.
Yeah,
I know a place across the street.
Tons of development going on in that area. It's huge developments going on. A lot of homes going up, but very convenient. Like just north of the 401, the 407, not far from what would it be there, Beauvert or whatever. But yeah, very accessible from a lot of different locations. So I think it's, again, in terms of services, like Brampton's got walk-in clinic, family practice, rehabilitation. There's even a med spa for facials and Botox injections, pharmacy, blood labs. So it's big. In Richmond Hill, the rehab services in Newmarket, the rehab services, plus we also have 2 physiatrists there that see OHIP patients. So if you're in that area and you need to see a physiatrist, just check out PinPoint Health and have your family doctor make that referral to those physiatrists if you need to be referred to one. But I think that's, I just wanted to share that. Make sure, obviously, our Etobicoke locations, but those are a little, they're more well known. But I wanted to definitely talk about those outskirts, and so hopefully in the next little bit we'll be even further east and even further west.
Well, I was going to say, right, you're currently expanding, and it's good.
So we're expanding, and we keep looking for reputable clinics that want to be part of the brand. And so, I mean, if you're someone listening and you have a rehab clinic, physio, chiro clinic, massage clinic, whatever type of clinic, and you're looking to be affiliated with a brand, and you do good work, and that's what we're looking for, please give me a call or send me an email, and I'm happy to discuss different opportunities, business opportunities. Not that this is a show about that. So even practitioners, so if you're a practitioner of any kind, and you're looking for somewhere to work, you've heard me, there's an individual that's starting with us in Richmond Hill who's heard me on the show, really identifies with my thoughts and the way I believe patient care should happen, and wants to work in that type of environment. So if you're, especially things like chiropractors, physiotherapists, massage therapists, big need right now. We got lots of massage patients all the time. Great opportunity to work in a clinical setting with so many different professionals. A lot of our massage therapists are really enjoy working with us because they get the chance to work with specialists, chiros, physios, social workers, like this whole multidisciplinary team where there's so many spa opportunities out there, and they're just looking for something a little more clinical. So if you're looking for that clinical thing to fit into your work schedule as a massage therapist, please give me a call as well.
Take a short break and move on. You want to reach Dr. Lou when the show's not on, by the way. I'll give you that number first, 1-855-55 Lou, DRLOU, or to call in the next few minutes and get some questions answered here on the radio show. 416-870-6400, star 640 on cell. PinPoint Health Show, Global News Radio. It is 11:53, last few minutes of the show. You got some time, 416-870-6400, star 640 on cell. You have any concerns, bring them on. We got to do a show. We got to do some updates with some past clients to see how they're doing. I know we got to get my sister-in-law to call in. I know she saw you a year ago.
We've had periodically people who have seen me and call in. I honestly try not. It's funny, like it's great, but I try not to purposefully do that because then it's like it's biased, right? So, but it's always encouraging. Like we've had a number of times people just randomly call in and say that they've seen me, and all of the feedback has always been positive, which is great to hear. I'm also happy to hear things that you weren't happy with.
Sure.
But yeah, if anyone's ever listening and you want to give that a shout out, please give me a call. I think that's good. It's good for other people to hear the truth of their experience, like what their reality is about the experience, which is also why I was encouraging the Google reviews, adding me on your social media stuff, because then you can interact. Like I'm very open and transparent when I say that I want to hear all of it. Like I want to hear what the reality is. And also it creates dialogue, right? Because someone might think something is negative, but then I may have a reason for it. And an example of that, I once had somebody call me. They had a chronic low back issue, and I guess I had said this on the radio once, and they called and they said, I really wasn't happy with your recommendations. And I said, okay. And I said, but why not? And they're like, well, because you said there was really, like, there wasn't much that I could do. And then I reviewed the file and I was like, well, hang on a sec. I told you that you could be doing rehabilitation exercises, that you could be building up your core, that you could be doing therapy when required, modifying your diet, et cetera, et cetera. They're like, yeah, but there's nothing else. I was like, what? But just because it doesn't exist, that's not my fault, right? So, I tried to, and then by the end they got it. They were like, okay, I see what you're saying. Like, it's like, fine, if you don't want to do that, you don't have to do that. But don't put that on me and say that there's nothing out there. I've never said that I sell some miracle cure in terms of like a procedure or a medication or something like that. We don't have miracles. We are here to help people manage their issues in a scientific way, in an evidence-based approach, an evidence-informed approach. And I think I keep that promise every time I see somebody. But I'm not here on the radio saying, hey, we've got this magical tool or this magical pill or this supplement that you could take and all of your pain will always be gone. I've never sold that, right? Like, do different tools, different supplements, different medications help in the management? Yeah, of course. So, maybe I recommend some of those things, but that doesn't mean that they're cures. And so, sometimes people don't like hearing the hard answers that I give, because a lot of times the actual management is difficult, because when you have chronic issues and when you're dealing with something complicated, if it's complicated, it's likely going to require a complicated answer. And if it's complicated, I can't change that. If it doesn't exist in the realm of possibilities, I can't just pull it out of my hat. You know what I mean? So I think that's an important thing that people realize. I'm not here to sell any magical cure or anything like that, but I am happy to do what I do here on the show, and what I do with my patients is give people a place that they can feel confident that they're getting the right type of answer. And I think if you've heard me on the radio, you can see the way I think. And I've had multiple other professionals call me and thank me for what I'm doing. We had a lady call last week who her husband's a GP, and she was thankful for us doing this. I was speaking to a group of family doctors this week that I'm actually going to be doing a continuing education session for on low back and spine related pain, just so that they can understand it better.
Cool.
For their referrals, for how they manage their patients. So again, I think what I'm here for is to really help people find the right path for their pain and injury. And I'm just going to tell you what the reality and what the evidence-informed approach is. And the other thing is I try to stay current with that stuff. So if there's ever new great things that are gonna help in these things, then I'm going to be the one that knows it to add it to the treatment plan.
Well, I mean, all the years you've been doing the show so far, the term cure has never been tossed around. It's always management.
Never the C word.
Always bold.
No C words underlined on this show.
That's right.
You've said management. It a few times. You've thrown it out. I've been like, hey,
cure me.
Be careful. Jody, cut it when he says it. Don't let him say cure.
Yeah, we got a dump button there, 17-second delay. Yeah, it's always underlined in bold, management. That's the way it's
management. Does that mean you can get to a point where you don't feel anything ever again? Sure. And that happens. I'm not calling that a cure, because to me, cure suggests it's gone forever.
Right.
And that's not the reality of anything in healthcare. I don't like that term almost for anything. So PinPoint Health is your place to help you manage and deal with all of the pain and injury issues that you have. Visit us at pinpointhealth.ca. Send me an email at info@pinpointhealth.ca. And stay tuned for next week.
You bet. PinPoint Health on social as well. Take advantage of all the stuff on Instagram and Facebook as far as videos and that are concerned. It's excellent stuff. And, of course, 1-855-55-Dr. Lou, DRLOU, to reach out. Do it now. Get it happening. We'll see you next week. PinPoint Health Show, Global News Radio.